much. Good afternoon, everyone. So as you know, Dr. Williams is currently he's chairing a meeting of the command table, so he's unable to join us. So tomorrow actually marks 3 months since Ontario had our first case of COVID-19. And of course, today the reality is very different. We now have, as of yesterday 4 p.m. in the IFAS database, 13,519 confirmed cases of COVID-19 in Ontario. And this is an increase of 640 cases since the day before. And of course, I'm pleased that over 50% of our cases have recovered, 7,087. We still have 910 people in hospital, and 243 of them are in the ICU. Tragically, 763 people have lost their lives due to COVID-19 in Ontario, which is an increase of 50 deaths since yesterday. I want to take a moment to offer my sincere condolences to all those who have lost family members or friends through COVID-19. While the numbers continue to increase, we remain cautiously optimistic that the outbreak in the community is peaking. This is in large part thanks to all of you in Ontario who have followed the advice of public health officials and continue to adhere to physical distancing measures. Your collective efforts are paying off, and I know it's hard, but we need you to keep it up. While we see our collective efforts are paying off in the broader community, we remain extremely concerned about what is occurring in our long-term care homes and other congregate settings. We now have 131 outbreaks in our long-term care homes. 573 residents and 1 staff member have lost their lives to COVID-19. I know that today the Premier announced the 5 homes that the Canadian Armed Forces will be supporting. And we will continue to support not only those homes, but all long-term care homes in the province to help slow the spread of COVID-19 and keep the residents and staff safe. Again, thank you to everyone for doing your part to protect the health of Ontarians. And with that, I'll open it up to questions.
Okay, we'll move to the phone lines.
Question from Alison Jones, Canadian Press.
Hi, Dr. Yaffe. I'm just hoping you could expand a little bit on your remark earlier that while the numbers are increasing, you're cautiously optimistic that we're in a peak period for the community anyway. How do we square the fact that we've seen 2 record highs 2 days in a row in terms of numbers of new cases, and also, we're also hearing that it's peaking?
Well, I said cautiously optimistic, and cautiously because we won't for sure know we're at the peak until after we've been at the peak and we're on the way down. But the modeling data that was presented earlier this week, based on the numbers, was showing that we are likely at a plateau. And the numbers, on the other hand, are going up, and that is probably because we're doing more testing, particularly in long-term care homes and other congregate settings. So again, cautiously optimistic about the community spread, but we can't say for sure until after the peak and we're on the way down.
Follow up?
No, that's all right. Thank you.
Okay, next question.
From Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Doctor. I'm wondering if you have any sense of how long the peak could last.
Unfortunately, I really can't say. I mean, we're hopefully at a plateau, and hopefully the plateau will end up being the peak. So it's not like one day. It could actually be weeks. We don't know.
Follow up?
Okay, thank you for that. And the other thing I noticed this week is that the number of people in ICU and on vents is relatively stable, but we've had the number of people in hospital go up from just over 100 since Monday. Do you know what's up with that?
I have actually, we've been actually asking for more specific data about the people in hospital and particularly on ventilators, what the outcome is, and so we're still awaiting that data. But your observation is correct. The number of people in hospital has been going up. The number in ICU has been going up slower, and the ventilators been going up slower as well. So that's the kind of information we're seeking to get more on.
Next question.
From Cynthia Mulligan at City News. Please go ahead.
Hello, Dr. Yaffe. I'm wondering if you can tell me then, because you mentioned that the numbers might be going up because we're testing more in long-term care homes. Do you have a sense of how many of the new cases just in the last 24 hours actually came from long-term care?
Well, with the proviso that, as you know, we are working with different databases, and so I'm going to be giving you data from the from two different databases that will give you different numbers. But certainly, what it looks like from our IFAS database that about 233 new cases were identified in long-term care residents in the last 24 hours, and about 26 new cases in staff in long-term care. So that would give us about 259 new cases in long-term care out of the 640. However, we might have slightly different information if we look at the long-term care data. But I would say roughly 259 out of the 640 new cases are in long-term care.
Follow up?
My other question is, do you have a sense of the recovery rate of seniors in long-term care that are infected? I mean, we have currently some 2,000 plus cases. Do you have a sense of the survival rate that we would be seeing with that? What percentage could survive?
Well, I guess, we look at it in terms of the other way, case fatality rate, which is the percentage of cases that don't survive. And it does tend to be, I don't have the data specific to our long-term care home cases at this point, but in general, the case fatality rate is higher in elderly or people with immunocompromising or other underlying morbidities. And it can be, 4 or 5% as opposed to 1 to 2% in the general population. So I don't have the specifics for our population, but as I say, it would not be surprising to have a higher case fatality rate in that population.
Next question.
From Haley Cooper at News Talk 1010.
Hi, Dr. Yaffe. We're seeing more and more companies mandate employee temperature checks. So we've seen Longo's, Tim Hortons, T&T Supermarket, Fiat Chrysler. So in the discussions that you've been having with the province, preparing to reopen, is this some advice that you're giving? Is this the most efficient way of screening employees daily, is doing these mandated temperature checks?
Well, I think it can be a component of screening, but it's not foolproof. Some cases, and we know some cases, in fact, have no symptoms, or they may not have a fever. And if you do a temperature check on a hot summer day, a lot of people might have a higher temperature. So it's not going to be the be-all and end-all. It might be a component of screening. I think screening is, again, just one component as well. We need to look at physical distancing and hand washing, access to hand washing, and lots of other kinds of measures that we would put into place to reduce the spread of COVID-19.
Follow up?
And so my follow-up, you mentioned physical distancing and hand washing, and we've discussed these mandated temperature checks. What else could we see companies mandate of employees in the near future and perhaps even longer as we see this province reopen?
Well, I'm just conjecturing here, but I think, certainly it's important for people not to come to work if they're sick. I mean, that's always been important, but I think its importance has been highlighted through the experience we've had with COVID-19. So I think probably looking at policies around sick time, around keeping people off work when they're sick, about screening, as you said, about keeping people apart as much as possible. There may be we may be looking at masking. I don't, we haven't really got to that yet. Right now we're looking at criteria for loosening of the requirements.
Okay, we're going to move to our last caller.
Question is from Mo Fahim at Vista Radio. Please go ahead.
Hi, doctor. Thank you. Can you hear me?
Yes.
Perfect. So my question is, how many of today's announced deaths were reported from long-term care homes?
Okay. Well, according to the data I have, 105 deaths were in residents of long-term care homes in the last 24 hours. So, on the other hand, the other database says there's only been 50 deaths since yesterday. So, somewhere between 50 and 105.
Follow-up?
It's very hard to say because of the different databases.
Okay, this is going to be our last question.
I guess my follow-up question: when do you expect to not see that rift between the databases? Is that something that's being worked on, or is that something that's just we're going to have to deal with until we're done?
I really don't know. I certainly we are working on it, and there's a lot of interest in bringing the databases together, but at this point, I think the best we can do is to present the data from both and be as transparent as possible and, go with it. We're trying, but I don't know if we'll be able to put them together or not.
Okay, looks like another caller has dropped in. Next question.
From Colin DeMello at CTV News. Please go ahead.
Hi, Dr. Yaffe. So I just wanted to pick up where the previous caller had left off. So in terms of the data right now, I mean, we're being told, okay, well, there's, one set of data coming from long-term care, another set of data coming from IFIS. So in terms of the total number of deaths currently in the province, what number are you going by? Are you going by the IFIS number, or are you also adding in the number from long-term care? Because they seem to be well ahead of IFIS.
You're correct. We are actually using IFIS because IFIS is the database that public health units use, and it's what we call an epidemiological database. So it has a lot of information about the cases, about their potential exposures, their demographics, their contacts, and so on. Whereas the long-term care database is an administrative database, and it basically gives numbers. And it serves the purpose that the Ministry of Long-Term Care requires, but doesn't give us the epidemiological information.
Okay, follow-up?
Thank you. IFIS seems to be, in some cases, several days behind the Ministry of Long-Term Care. I'm not sure if you know why IFIS and the information data they have is so far delayed, and what confidence do you actually have in the system that is giving you a clear indication of COVID-19 in the province right now?
Well, no system is perfect, and we know each system has its strengths and weaknesses. In terms of deaths, actually we've been talking about the differences, and I'll start with the Ministry of Long-Term Care data on deaths. We are not sure about what case definition they're using in terms of, are they counting people who died with or of COVID-19, or are they also counting other people who died? So that's one issue on that side. In terms of IFIS data, they're usually part of an outbreak, and in IFIS they go into an outbreak database, and I don't know the specific details, but the outbreak has to be finished and closed before all the data may not be input until the end. So that's just a vagary of the system, the way the instructions are made. So we may end up with a backlog that eventually will be reflected in the data when the outbreaks are done and resolved. So that all sounds very, administrative and easily fixed, but it isn't that easily fixed, and we're working on it. And I think it's just the most important thing to recognize is that there probably are more deaths in long-term care than we're reflecting in IFAS. And there may be as many as the long-term care database is showing, or there might be slightly less. And regardless of the numbers, we know it's a serious problem, and public health units are working very hard to, with their long-term care homes, with Public Health Ontario, with the local hospitals, and with others, to do everything we can to prevent and control the spread of this infection with this very high-risk population.
Okay, thanks everyone.